Question 1. Neurological rehabilitation. Autonomic dysreflexia management. 35-year-old male patient with T-spinal cord injury is experiencing sudden and severe headache, profuse sweating above the level of injury, and dangerously high blood pressure. The rehabilitation nurse recognizes that the patient is likely experiencing autonomic dysreflexia, life-threatening medical emergency. What is the nurse's first priority action? A. Administer an antihypertensive medication to lower the patient's blood pressure immediately. B. Place the patient in supine position and monitor vital signs. C. Identify and eliminate the noxious stimulus, such as distended bladder or fecal impaction. D. Increase intravenous fluid administration to promote circulation. Answer: C. Identify and eliminate the noxious stimulus, such as a distended bladder or fecal impaction. Explanation: autonomic dysreflexia is a medical emergency that occurs in patients with spinal cord injuries at or above this level. It is triggered by a noxious stimulus such as bladder distension, fecal impaction, or tight clothing. The immediate intervention is to identify and remove the stimulus, as this is the root cause of the sympathetic response. Option A is incorrect because administering an antihypertensive does not address the underlying cause. While medication may be used if blood pressure remains dangerously high, it is not the first priority intervention. Option B is incorrect because a supine position may worsen the hypertensive crisis. Instead, the patient should be placed in an upright sitting position to help lower blood pressure. Option D is incorrect because increasing Roman fluids is not a first-line intervention in autonomic dysreflexia. The focus should be on resolving the underlying cause. According to the Consortium for Spinal Cord Medicine guidelines, immediate nursing interventions should include elevating the head of the bed or sitting the patient up to help lower blood pressure, checking for a distended bladder, catheter kinks, full bladder, and relieving retention, assessing for impaction and performing manual rectal stimulation if necessary, removing restrictive clothing or other potential irritants, administering antihypertensive medication only if blood pressure remains elevated despite removing the stimulus. Question 2. Ethical and legal aspects. Patient autonomy and rehabilitation. 78-year-old patient with severe osteoarthritis and history of multiple falls is undergoing rehabilitation after hip replacement. The interdisciplinary team strongly recommends continued inpatient rehabilitation for fall prevention and strengthening. However, the patient, who is alert and oriented, insists on being discharged home against medical advice. The best course of action for the rehabilitation nurse: A. Refuse the discharge request and inform the patient that they must follow medical advice. B. Obtain court order to keep the patient in rehabilitation to prevent harm. C. Respect the patient's decision, ensure they understand the risks, and document an discharge form. D. Persuade the patient's family to take legal guardianship and make medical decisions on their behalf. Answer: C. Respect the patient's decision, ensure they understand the risks, and document an discharge form. Explanation: the fundamental principle of patient autonomy dictates that competent adults have the right to make their own healthcare decisions, even if they go against medical advice. In this scenario, the patient is alert, oriented, and fully capable of making an informed decision about their care. The role of the rehabilitation nurse is to educate the patient about the potential risks of leaving rehabilitation prematurely, e.g., increased fall risk, incomplete recovery, ensure informed consent by discussing all possible consequences and alternative options, document the refusal of treatment properly in an discharge form, which should include detailed explanation that the patient was fully informed of the risks. Option A is incorrect because forcing patient to stay against their will violates their right to autonomy. Option B is incorrect because obtaining court order is not justified unless the patient is legally incapacitated or poses an immediate threat to themselves or others. Option D is incorrect because unless the patient has been legally deemed incompetent, their family does not have the right to override their decision. According to the American Nurses Association Honor Code of Ethics, nurses must respect patient autonomy and ensure informed consent in all medical decisions. Question 3. Scenario-based. Pain management in rehabilitation. MS Carter, 50-year-old woman with chronic low back pain due to degenerative disc disease, is undergoing rehabilitation. She reports significant pain despite taking opioid analgesics as prescribed. She expresses frustration, stating, "These medications just make me feel groggy, but the pain is still there." The nurse recognizes that effective pain management in rehabilitation requires multimodal approach. Which of the following interventions be the most appropriate next step? A. Increase the dosage of opioid medication to provide better pain relief. B. Incorporate non-pharmacological strategies such as physical therapy, cognitive behavioral therapy, and TENS therapy. C. Discontinue all pain medication to prevent opioid dependency. D. Refer the patient for surgical evaluation, as all non-invasive methods have failed. Answer: B. Incorporate non-pharmacological strategies such as physical therapy, cognitive behavioral therapy, and TENS therapy. Explanation: chronic pain management in rehabilitation must go beyond opioid use to address the underlying causes and improve function. A multimodal approach combining pharmacologic and non-pharmacologic therapies is the best evidence-based strategy. This includes physical therapy to strengthen muscles, posture, and enhance mobility, cognitive behavioral therapy (CBT) to address the emotional and psychological aspects of pain, transcutaneous electrical nerve stimulation (TENS) therapy, which can help modulate pain perception, alternative therapies like acupuncture, yoga, or mindfulness-based stress reduction. Option A is incorrect because increasing opioid dosage does not necessarily improve pain control and carries a higher risk of tolerance, dependence, and side effects. Option C is incorrect because abruptly discontinuing pain medication without an alternative plan can lead to withdrawal symptoms and unmanaged pain. Option D is incorrect because surgical intervention should only be considered if all conservative measures have failed and imaging confirms a surgically correctable pathology. According to the CDC guidelines for chronic pain management, opioids should be used only when necessary and in combination with non-opioid therapies to minimize risks. The American Pain Society also recommends an interdisciplinary approach for chronic pain, emphasizing rehabilitation techniques over sole reliance on medications. Question 4. Neurological rehabilitation. Stroke rehabilitation. A 68-year-old male patient, Mr. Thompson, is admitted to the rehabilitation unit after experiencing a left middle cerebral artery Mackay ischemic stroke. He presents with right-sided hemiparesis, expressive aphasia, and impaired swallowing dysphagia. The rehabilitation team aims to improve his functional independence, communication, and nutrition. Given his which of the following interventions should the rehabilitation nurse prioritize to enhance his recovery? A. Encourage the patient to use his left side more by placing objects on the left side of his field of vision. B. Implement a pureed diet and thickened liquids to prevent aspiration during meals. C. Provide an augmented communication device to facilitate patient expression and comprehension. D. Perform passive range of motion (ROM) exercises only on the unaffected side to prevent contractures. Answer: C. Provide an augmented communication device to facilitate patient expression and comprehension. Explanation: expressive aphasia, Broca's aphasia, results from damage to the dominant hemisphere's language areas, making it difficult for the patient to express thoughts verbally. Augmentative and alternative communication (IC) devices, such as picture boards or electronic devices, help improve communication and reduce frustration. A. Incorrect. Patients with left Mackay stroke often experience right-sided hemiparesis and may have neglect on the right side and not the left. Placing objects on the left would not address the problem. B. Incorrect. While dysphagia management is critical, dietary modifications require assessment by a speech-language pathologist before implementing a specific diet. D. Incorrect. Performing ROM exercises only on the unaffected side neglects affected limb, increasing the risk of contractures and muscle atrophy. Both sides should be engaged in therapy is tolerated. Relevant guidelines. American Stroke Association guidelines recommend multimodal approaches for post-stroke rehabilitation, including communication strategies and early mobilization. The National Institute of Neurological Disorders and Stroke (NINDS) emphasizes interdisciplinary collaboration to maximize patient outcomes. Question 5. Bowel and bladder management. Neurogenic bowel and bladder disorders. A rehabilitation nurse is working with a 42-year-old female patient, Ms. Rodriguez, who sustained a spinal cord injury following a motor vehicle accident. The patient has developed neurogenic bladder and bowel dysfunction. She reports frequent episodes of incontinence and constipation, significantly affecting her quality of life. Following interventions is most appropriate for managing her condition. A. Schedule intermittent catheterization every 4-6 hours to prevent urinary retention. B. Advise the patient to use a low-fiber diet to minimize bowel movements and reduce incontinence episodes. C. Encourage the use of indwelling catheters for long-term bladder management. D. Administer antispasmodic medications to reduce bladder contractions and eliminate the need for catheterization. Answer A. Schedule intermittent catheterization every 4-6 hours to prevent urinary retention. Explanation. Patients with psi at level typically develop reflex, spastic bladder and bowel, leading to urinary retention, overflow, incontinence, and constipation. Intermittent catheterization is the preferred method for bladder management because it reduces the risk of infections and kidney damage while promoting independence. B. Incorrect. A high-fiber diet is recommended to improve bowel motility and prevent constipation. C. Incorrect. Indwelling catheters are associated with a higher risk of urinary tract infections (UTIs) and should not be used long-term unless absolutely necessary. D. Incorrect. Antispasmodic medications may help with bladder control. They do not eliminate the need for catheterization in patients with neurogenic bladder. Relevant guidelines. The Consortium for Spinal Cord Medicine guidelines recommend intermittent catheterization as the preferred method for bladder management in patients with psi. Question 6. Psychological and emotional aspects of rehabilitation. Adjustment to disability and coping mechanisms. A 35-year-old construction worker, Mr. Anderson, recently underwent a below-the-knee amputation (BK) after a traumatic workplace injury. During a rehabilitation session, he expresses feelings of hopelessness, anger, and frustration, stating that he will never be able to work again and avoids participating in therapy. Which of the following interventions should the rehabilitation nurse implement to support his emotional well-being? A. Encourage the patient to express his emotions and connect him with peer support groups for amputees. B. Reinforce the importance of participation in therapy and insist that he attend all sessions to improve outcomes. C. Focus discussions only on the physical aspects of rehabilitation to avoid emotional distress. D. Suggest that he delay the rehabilitation process until he fully accepts his condition. Answer A. Encourage the patient to express his emotions and connect him with peer support groups for amputees. Explanation. Patients undergoing limb loss often experience grief, depression, and anxiety. Peer support groups and psychological counseling can significantly improve coping and adjustment. Encouraging open communication helps validate the patient's emotions and facilitates rehabilitation engagement. B. Incorrect. Forcing participation without addressing emotional readiness can lead to resistance and non-compliance. C. Incorrect. Avoiding emotional discussions does not help the patient process his new reality and may lead to maladaptive coping strategies. D. Incorrect. Delaying rehabilitation can result in physical deconditioning and increased disability. Early intervention is critical. Relevant guidelines. The American Psychological Association (APA) highlights the importance of psychosocial support in rehabilitation. Motivational interviewing techniques are recommended for promoting patient engagement in therapy. Question 7. Cardiopulmonary rehabilitation. Chronic obstructive pulmonary disease (COPD) and pulmonary rehabilitation. A 72-year-old male patient, Mr. Lewis, is enrolled in a pulmonary rehabilitation program due to advanced COPD. He complains of significant shortness of breath with minimal exertion and fears engaging in physical activities. Which of the following strategies is most effective in improving his exercise tolerance or minimizing dyspnea? A. Encourage pursed lip breathing and gradual increases in activity to reduce breathlessness. B. Advise the patient to use oxygen continuously at the highest possible flow rate to prevent desaturation. C. Restrict physical activity to avoid worsening of symptoms and preserve lung function. D. Recommend immediate corticosteroid therapy to reduce inflammation and enhance exercise capacity. Answer A. Encourage pursed lip breathing and gradual increases in activity to reduce breathlessness. Explanation. Pursed lip breathing helps slow expiration, decrease air trapping, and reduce dyspnea in COPD patients. Gradual activity increases combined with supervised exercise can enhance endurance and improve respiratory muscle strength. B. Incorrect. Oxygen therapy should be titrated based on SPO levels, and excessive oxygen administration lead to co-retention in COPD patients. C. Incorrect. Avoiding activity leads to deconditioning and worsens functional decline. D. Incorrect. Corticosteroids are used for acute exacerbations rather than for long-term exercise improvement. Relevant guidelines. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) recommends pulmonary rehabilitation, including breathing techniques and progressive exercise for COPD management. Question 8. Spinal cord injury. Autonomic dysreflexia. a 27-year-old male patient with a complete spinal cord injury. Sy is admitted to the rehabilitation unit. He suddenly develops severe hypertension, a P109 to 100 at 80, a pounding headache, nasal congestion, and sweating above the level of injury. The nurse suspects autonomic dysreflexia. At which of the following interventions should be performed? First, A. Place the patient in a supine position to maintain blood pressure stability. B. Administer intravenous Roman antihypertensive medications to control blood pressure. C. Check for noxious stimuli such as bladder distension and remove the cause. D. Increase fluid intake to promote urinary output and reduce AD episodes. Answer C. Check for noxious stimuli such as bladder distension and remove the cause. Explanation. Autonomic dysreflexia AD is a life-threatening condition that occurs inside patients above. It is triggered by noxious stimuli, e.g. bladder distension, constipation, tight clothing, leading to a severe hypertensive crisis. Immediate identification and removal of the trigger, e.g. draining a full bladder, is the priority intervention. A. Incorrect. The patient should be placed in a sitting position, not supine, to reduce blood pressure. B. Incorrect. Medications may be needed, but they are not the first intervention. D. Incorrect. Increasing fluids does not address the acute cause of AD. Relevant guidelines. The Consortium for Spinal Cord Medicine states that identifying and removing the trigger is the first step in AD management. Question 9. Stroke rehabilitation. Hemineglect and spatial awareness. A 60-year-old female patient is undergoing stroke rehabilitation after a right hemisphere stroke. The nurse notices that she consistently ignores food on the left side of her plate and does not respond when spoken to from her left side. What is the most effective nursing intervention to improve her functional independence? A. Encourage her to always turn her head to the left when eating or interacting. B. Place all necessary items on her right side to accommodate her neglect. C. Assist her with feeding exclusively from the right side. D. Restrict activities requiring left side engagement until cognitive function improves. Answer A. Encourage her to always turn her head to the left when eating or interacting. Explanation. Patients with left-sided neglect due to a right hemisphere stroke are unaware of stimuli on their left side. Encouraging scanning techniques, such as actively turning their head, helps retrain spatial awareness and improve independence. B. Incorrect. Placing items only on the right reinforces neglect and delays recovery. C. Incorrect. Assistive should promote engagement with the neglected side. D. Incorrect. Avoiding left side activities that worsens neglect rather than rehabilitating it. Relevant guidelines. American Stroke Association recommends visual scanning training to improve neglect. Question 10. Traumatic brain injury. Cognitive impairment and agitation management. A 45-year-old male patient with a moderate traumatic brain injury (TBI) exhibits agitation, confusion, and impulsive behavior during his rehabilitation. He frequently attempts to remove aromanolin and becomes verbally aggressive when redirected. What is the best approach for managing his agitation? A. Apply physical restraints to prevent injury. B. Reduce environmental stimulation and provide a structured routine. C. Increase sedative medication doses to decrease aggressive episodes. D. Allow the patient to have unstructured time alone to promote autonomy. Answer B. Reduce environmental stimulation and provide a structured routine. Explanation. Agitation in TBI is often due to cognitive impairment, overstimulation, or frustration. A structured, low-stimulation environment helps reduce confusion and aggression. A. Incorrect. Restraints should be avoided whenever possible due to the risk of worsening agitation. C. Incorrect. Oversedation impairs cognitive recovery and prolongs rehabilitation. D. Incorrect. Unstructured time increases confusion and agitation. Relevant guidelines. Brain Injury Association of America emphasizes environmental modifications over restraints for managing TBI-related agitation. Question 11. Pain management. Neuropathic pain in rehabilitation. A 53-year-old patient with diabetic neuropathy reports burning pain in his feet that worsens at night. Which of the following medications is most appropriate for managing his neuropathic pain? A. Ibuprofen 800 mg every 8 hours. B. Gabapentin 300 mg at bedtime. C. Morphine 5 mg every 6 hours as needed. D. Acetaminophen 500 mg every 6 hours. Answer B. Gabapentin 300 mg at bedtime. Explanation. Neuropathic pain requires medications that modulate nerve signaling such as gabapentin or pregabalin. A. Incorrect. NSAIDs like ibuprofen are ineffective for neuropathic pain. C. Incorrect. Opioids should be avoided for chronic neuropathic pain due to addiction risk. D. Incorrect. Acetaminophen only addresses nociceptive pain, not nerve pain. Relevant guidelines. American Academy of Neurology recommends gabapentin as first-line therapy for neuropathic pain. Question 12. Cardiac rehabilitation. Activity intolerance post-myocardial infarction. A 67-year-old patient is enrolled in Ferzomen to cardiac rehabilitation after a myocardial infarction. During exercise, his heart rate increases from 72 to 140 bpm, and he reports dizziness and chest tightness. What should the nurse do first? A. Stop the exercise immediately and assess vital signs. B. Encourage him to push through mild discomfort to build endurance. C. Administer nitroglycerin and continue the session. D. Increase fluid intake to improve circulation. Answer. A. Stop the exercise immediately and assess vital signs. Explanation. A rapid heart rate increase with chest tightness suggests exertional ischemia requiring immediate evaluation to prevent further cardiac injury. B. Incorrect. Symptoms like dizziness require stopping activity, not pushing through. C. Incorrect. Nitroglycerin may be needed, but assessment comes first. D. Incorrect. Fluid intake is not a priority in acute symptoms. Relevant guidelines. American Heart Association (AHA) recommends stopping activity at onset of symptoms. Would you like more case-based questions or specific topics covered? Question 13. Multiple sclerosis. Fatigue management and exercise tolerance. 40-year-old female patient with multiple sclerosis (MS) reports severe fatigue that worsens in the afternoon. She enjoys light exercise but experiences weakness and dizziness after 20 minutes of activity. What is the most appropriate nursing recommendation to help her maintain function? A. Engage in high-intensity exercise in the morning to build endurance. B. Encourage her to take rest breaks and perform activities in cool environment. C. Advise her to push through fatigue to improve overall stamina. D. Reduce exercise altogether to avoid worsening symptoms. Answer. B. Encourage her to take rest breaks and perform activities in a cool environment. Explanation. Fatigue in MS is often worsened by heat and overexertion. The cooling technique, air conditioning, cooled showers, and energy conservation strategies, rest breaks, pacing activities help manage symptoms without over-fatiguing the patient. A. Incorrect. High-intensity exercise can worsen fatigue in MS. C. Incorrect. Pushing through fatigue increases symptom severity. D. Incorrect. Exercise should be modified, not eliminated, for long-term health. Relevant guidelines. National Multiple Sclerosis Society recommends energy conservation and temperature regulation strategies. Question 14. Parkinson's disease. For prevention and mobility training, 68-year-old male patient with Parkinson's disease experiences shuffling gait, frequent freezing episodes, and falls when walking through doorways. What is the best nursing intervention to improve mobility and prevent falls? A. Encourage slow, cautious gait with minimal movement. B. Recommend using four-wheeled walker at all times. C. Teach visual cueing techniques, such as stepping over imaginary lines. D. Suggest prolonged bed rest to avoid fall risk. Answer. C. Teach visual cueing techniques, such as stepping over imaginary lines. Explanation. Freezing a gait fog in Parkinson's disease can be improved with external visual cues such as imaginary lines, rhythmic stepping, or auditory cues, e.g. counting steps. A. Incorrect. Slow gait worsens freezing episodes. B. Incorrect. Walkers can be useful but do not directly address fog. D. Incorrect. Bed rest leads to deconditioning and worsens mobility. Relevant guidelines. American Parkinson Disease Association recommends cueing techniques for freezing episodes. Question 15. Stroke rehabilitation. Aphasia communication strategies. 55-year-old female patient with Broca's aphasia struggles to express herself but understands spoken language. Which communication strategy should the nurse use to support her? A. Speak in louder tone to facilitate understanding. B. Use yes-no questions and encourage non-verbal communication. C. Avoid conversations to reduce frustration. D. Only allow family members to speak for her. Answer. B. Use yes-no questions and encourage non-verbal communication. Explanation. Broca's aphasia, expressive aphasia, affects speech production but not comprehension. Using yes-no questions, gestures, and writing tools improves communication. A. Incorrect. Speaking louder does not help. She understands but struggles to respond. C. Incorrect. Avoiding conversation hinders language recovery. D. Incorrect. Encouraging independence in communication is crucial. Relevant guidelines. American Stroke Association recommends alternative communication strategies for aphasia patients. Question 16. Amputation rehabilitation. Phantom limb pain management. 60-year-old male patient who underwent below-knee amputation reports severe phantom limb pain in the missing foot. What is the best initial intervention? A. Administer gabapentin to manage neuropathic pain. B. Encourage the patient to ignore the pain to promote adaptation. C. Avoid touching the residual limb to prevent worsening symptoms. D. Recommend bed rest until the pain subsides. Answer: A. Administer gabapentin to manage neuropathic pain. Explanation: phantom limb pain is neuropathic and best managed with gabapentin, pregabalin, or myotherapy. B. Incorrect. Ignoring pain does not help. It needs active treatment. C. Incorrect. Gentle desensitization techniques improve pain. D. Incorrect. Prolonged bed rest worsens deconditioning. Relevant guidelines. Amputee Coalition supports neuropathic pain medications. Phantom limb pain. Question 17. Spinal cord injury. Neurogenic bowel management. 35-year-old paraplegic patient with T-spinal cord injury has neurogenic bowel dysfunction with chronic constipation. What is the best intervention? A. Use scheduled bowel program with stool softeners and digital stimulation. B. Give laxatives daily to prevent constipation. C. Restrict fluid intake to prevent bowel accidents. D. Perform frequent enemas for bowel regulation. Answer: A. Use a scheduled bowel program with stool softeners and digital stimulation. Explanation: neurogenic bowel requires timed bowel programs including diet, fluids, fiber, stool softeners, and digital stimulation. B. Incorrect. Laxative overuse can cause dependency. C. Incorrect. Adequate hydration is crucial for bowel function. D. Incorrect. Frequent enemas can lead to dependence and electrolyte imbalance. Relevant guidelines. Consortium for Spinal Cord Medicine recommends structured bowel programs for PSI patients. Question 18. Traumatic brain injury. Family education on behavioral changes. Patient with moderate TBI exhibits irritability, impulsivity, and emotional outbursts. His wife is struggling to manage his behavior. What is the best nursing intervention? A. Educate the family on behavioral triggers and de-escalation techniques. B. Recommend the family avoid interactions to reduce stress. C. Encourage strict punishment for inappropriate behavior. D. Suggest long-term care facility due to personality changes. Answer: A. Educate the family on behavioral triggers and de-escalation techniques. Explanation: TBI-related behavioral changes require structured management, including calm environments, redirection, and avoiding overstimulation. B. Incorrect. Family involvement is key to recovery. C. Incorrect. Punishment worsens impulsivity. D. Incorrect. Many TBI patients can live at home with support. Relevant guidelines. Brain Association of America supports family education programs. Would you like additional case-based questions or focus on specific rehabilitation topics? Question 19. Stroke rehabilitation. Dysphagia and aspiration precautions. 72-year-old male patient with left-sided ischemic stroke is experiencing dysphagia with frequent coughing and choking while eating. Swallowing assessment confirms high aspiration risk. What is the most appropriate nursing intervention to prevent aspiration? A. Offer thin liquids to make swallowing easier. B. Place the patient in reclined position while eating to reduce choking. C. Use modified diet with thickened liquids and encourage chin tuck technique. D. Encourage large bites and rapid swallowing to prevent food accumulation. Answer: C. Use a modified diet with thickened liquids and encourage a chin tuck technique. Explanation: dysphagia following stroke increases aspiration pneumonia risk. Thickened liquids a chin tuck technique help control the bolus and reduce aspiration risk. A. Incorrect. Thin liquids are the hardest to control and increase aspiration risk. B. Incorrect. The patient should be in an upright position 90 degrees while eating. D. Incorrect. Small bites and slow swallowing reduce aspiration risk. Relevant guidelines. American Stroke Association recommends diet modification and swallowing therapy for dysphagia. Question 20. Spinal cord injury. Autonomic dysreflexia emergency management. 30-year-old patient with C-spinal cord injury reports sudden severe headache, flushing above the level of injury, and elevated blood pressure, BP 109 to 100 Hg. What is the priority nursing intervention? A. Lower the patient's head to flat position. B. Check for bladder distension or bowel impaction. C. Apply compression stockings to improve circulation. D. Administer omeatids to increase perfusion. Answer: B. Check for bladder distension or bowel impaction. Explanation: this patient has autonomic dysreflexia and a life-threatening emergency in spinal cord injuries above. Bladder distension or bowel impaction is the most common trigger. A. Incorrect. The head should be elevated at least 45 degrees to reduce BP. C. Incorrect. Compression stockings can worsen hypertension in ant. D. Incorrect. Fluid administration can exacerbate hypertension in ant. Relevant guidelines. Consortium for Spinal Cord Medicine recommends immediate bladder bowel assessment in ant. Question 21. Traumatic brain injury. Memory and cognitive rehabilitation. 45-year-old patient with moderate traumatic brain injury (TBI) struggles with short-term memory loss and difficulty following instructions. What is the best nursing intervention to improve cognitive function? A. Encourage written reminders and repetition of information. B. Offer complex, multi-step instructions to enhance problem solving. C. Limit social interaction to prevent cognitive overload. D. Provide sedating medications to reduce frustration. Answer: A. Encourage written reminders and repetition of information. Explanation: TBI patients benefit from structured cognitive rehabilitation, including notebooks, repetition, and cueing to enhance memory function. B. Incorrect. Breaking tasks into small steps is more effective than complex instructions. C. Incorrect. Social interaction supports cognitive recovery. D. Incorrect. Sedation can worsen cognitive dysfunction. Relevant guidelines. Brain Injury Association of America recommends structured memory strategies for TBI recovery. Question 22. Spinal cord injury. Pressure ulcer prevention. Paraplegic patient with T-spinal cord injury has redness over the sacrum that does not blanch with pressure. What is the most appropriate nursing intervention? A. Apply foam dressing and continue monitoring. B. Reposition the patient every 2 hours and provide pressure relief. C. Massage the area to improve circulation. D. Allow the patient to remain in the same position to avoid discomfort. Answer: B. Reposition the patient every 2 hours and provide pressure relief. Explanation: a non-blanching red area indicates a stage 1 pressure ulcer requiring pressure relief, repositioning, and skin protection. A. Incorrect. A foam dressing is not the primary intervention. C. Incorrect. Massaging can worsen tissue damage. D. Incorrect. Prolonged pressure worsens the ulcer. Relevant guidelines. National Pressure Injury Advisory Panel (NPIAP) recommends frequent repositioning for pressure ulcer prevention. Question 23. Amputation rehabilitation. Prosthetic training and skincare. 55-year-old patient with below-knee amputation is learning to use prosthesis. The patient reports pain and skin irritation at the residual limb site. What is the best nursing intervention? A. Encourage gradual wearing time to prevent skin breakdown. B. Apply lotion before using the prosthesis. C. Ignore discomfort as it is normal part of adjustment. D. Tighten the prosthesis to reduce movement. Answer: A. Encourage gradual wearing time to prevent skin breakdown. Explanation: gradually increasing prosthesis use time allows the residual limb to adapt, reducing friction and skin breakdown. B. Incorrect. Lotion can cause skin softening, increasing breakdown risk. C. Incorrect. Pain should be assessed and addressed. D. Incorrect. A too tight prosthesis increases skin irritation. Relevant guidelines. Amputee Coalition supports GRAP. Prosthesis adaptation to prevent complications. Question 24. Spinal cord injury. Sexual function education. Male patient with T-spinal cord injury expresses concerns about sexual function after injury. What is the most accurate information the nurse should provide? A. Sexual function is completely lost after spinal cord injury. B. Reflexive erections are possible, but ejaculation may be impaired. C. There are no medical treatments available for sexual dysfunction. D. You should avoid sexual activity due to risk of complications. Answer: B. Reflexive erections are possible, but ejaculation may be impaired. Explanation: patients with Cyabuft often retain reflexive erections but have impaired ejaculation and sensation. Treatments like phosphodiesterase inhibitors, e.g. sildenafil, may help. A. Incorrect. Sexual function is not completely lost. C. Incorrect. Medical treatments exist, e.g. sildenafil, vacuum pumps. D. Incorrect. Patients can safely engage in sexual activity. Relevant guidelines. Consortium for Spinal Cord Medicine provides education on sexual health post-site. Question 25. Traumatic brain injury. Behavioral and emotional regulation. 36-year-old male, patient with moderate traumatic brain injury (TBI) exhibits agitation, impulsivity, and difficulty managing frustration during rehabilitation. The rehabilitation team reports that he becomes easily overwhelmed and has difficulty following redirection. What is the most appropriate nursing intervention to help manage his behavior? Symptoms: A. Place the patient in low stimulation environment and use structured routines. B. Provide unlimited free time to help him regain independence. C. Challenge the patient frequently with difficult cognitive tasks to enhance problem solving. D. Encourage open-ended questions to help the patient explore frustration. Answer: A. Place the patient in a low stimulation environment and use structured routines. Explanation: EBI patients often struggle with agitation and impulsivity, requiring a structured, low-stimulation environment to prevent overstimulation and frustration. B. Incorrect. Unstructured time can increase frustration and agitation. C. Incorrect. Difficult cognitive tasks can worsen behavioral dysregulation. D. Incorrect. Open discussions can be overwhelming. Relevant guidelines. Brain Injury Association of America recommends structured environments for TBI patients. Question 26. Spinal cord injury. Neurogenic bladder management. 28-year-old patient with spinal cord injury experiences urinary retention and is at risk for autonomic dysreflexia. The patient wants to be as independent as possible with bladder management. What is the best nursing recommendation for this patient's bladder care? A. Teach the patient to perform intermittent catheterization every 4-6 hours. B. Insert an indwelling Foley catheter for long-term management. C. Encourage the patient to limit fluid intake to reduce urinary urgency. D. Recommend wearing adult diapers to manage incontinence. Answer: A. Teach the patient to perform intermittent catheterization every 4-6 hours. Explanation: patients with spinal cord injuries above often develop neurogenic bladder, increasing UT and autonomic dysreflexia risk. Intermittent catheterization is the preferred method to promote independence and reduce complications. B. Incorrect. Indwelling catheters increase UT and kidney stone risk. C. Incorrect. Limiting fluid intake can cause bladder infections. D. Incorrect. Diapers are not an ideal long-term solution. Relevant guidelines. Consortium for Spinal Cord Medicine recommends intermittent catheterization for neurogenic bladder. Question 27. Stroke rehabilitation. Post-stroke depression and emotional support. 62-year-old patient who suffered right hemisphere stroke exhibits emotional lability, crying episodes, and social withdrawal. The patient states, "I don't feel like myself anymore." What is the most appropriate nursing intervention? A. Encourage participation in social activities and support groups. B. Recommend complete rest and avoid discussing emotions. C. Avoid addressing the patient's emotions to prevent distress. D. Advise against rehabilitation therapy to reduce stress. Answer: A. Encourage participation in social activities and support groups. Explanation: post-stroke depression (PSD) affects up to 30% of stroke survivors, impacting recovery. Social support, structured activities, and counseling help improve emotional well-being. B. Incorrect. Isolation worsens depression. C. Incorrect. Acknowledging emotions is crucial for recovery. D. Incorrect. Rehabilitation is essential for stroke recovery. Relevant guidelines. American Stroke Association recommends psychosocial support for post-stroke depression. Question 28. Amputation rehabilitation. Phantom limb pain management. 58-year-old male with right above knee amputation reports severe phantom limb pain, describing burning and cramping sensations in the missing limb. Which nursing intervention is most effective for managing phantom limb pain? A. Administer gabapentin or amitriptyline as prescribed. B. Encourage the patient to ignore the pain and focus on rehabilitation. C. Apply tight compression wraps over the residual limb. D. Recommend only opioid medications for pain relief. Answer: A. Administer gabapentin or amitriptyline as prescribed. Explanation: phantom limb pain results from nerve damage and cortical reorganization in the brain. Neuropathic pain medications such as gabapentin and amitriptyline are first-line treatments. B. Incorrect. Ignoring the pain does not reduce symptoms. C. Incorrect. Compression may help stump pain, but not phantom pain. D. Incorrect. Opioids are not first-line treatment. Neuropathic pain. Relevant guidelines. Amputee Coalition recommends neuropathic pain management strategies for phantom pain. Question 29. Parkinson's disease. Mobility and fall prevention. 74-year-old patient with Parkinson's disease experiences frequent falls, shuffling gait, and difficulty initiating movement. What is the best intervention to improve mobility and reduce fall risk? A. Teach the patient to use visual cues and rhythmic stepping. B. Recommend complete bed rest to avoid falls. C. Encourage fast movements to overcome rigidity. D. Discontinue physical therapy to prevent overexertion. Answer: A. Teach the patient to use visual cues and rhythmic stepping. Explanation: Parkinson's disease leads to bradykinesia and freezing episodes. Visual and auditory cues, e.g., stepping over line using metronomes, help initiate movement. B. Incorrect. Bed rest worsens muscle weakness. C. Incorrect. Rapid movements increase fall risk. D. Incorrect. Physical therapy improves mobility. Relevant guidelines. Parkinson's found supports cognitive motor training techniques. Question 30. Multiple sclerosis, fatigue management and energy conservation. 42-year-old female with relapsing remitting multiple sclerosis MS complains of severe fatigue, limiting her ability to perform daily tasks. Which nursing intervention is most appropriate to help manage fatigue? A. Teach energy conservation techniques such as prioritizing tasks. B. Encourage continuous strenuous exercise to build endurance. C. Recommend increased caffeine intake to reduce fatigue. D. Advise the patient to stay in bed during fatigue episodes. Answer: A. Teach energy conservation techniques such as prioritizing tasks. Explanation: Fatigue in MS is managed through energy conservation techniques including pacing, resting between activities, and prioritizing tasks. B. Incorrect. Overexertion worsens fatigue. C. Incorrect. Caffeine is not a long-term solution. D. Incorrect. Staying in bed leads to deconditioning. Relevant guidelines. National MS Society recommends energy conservation for MS fatigue.